Welcome back here to CSM. My name is Jillian McLean. I am the Student Assembly Board of Directors, Director of Communications, and I'm here with Zach Stearns. He wrote a really popular Pulse blog earlier last year. It's called 3 Things I Wish I Knew Before Clinicals. So Zach, number 1 was that you realize you don't know much. How do students approach to knowing they don't know much? And they ask their CIs, how do they go about it?
Sure, it's a good question. I think it really starts with your mindset. So it takes some humility to be able to go into a clinic and say, I have a lot of things to learn. I don't know everything there is to know. Especially once you go out into rotations and if you did well in class, you probably feel pretty confident. And I was one of those. But once you find that there's a lot more to learn, then it really takes a growth mindset. Say an attitude, I still have so much more to learn. And that really makes a big difference, because if you come in thinking that you already know it all, you cannot develop a really great relationship with your CI. And that's really what it's meant for, that it's really treated as if it's a course that in which you have something to learn, not only from your patients or from you, but also from your clinical instructor.
I think that's important. I know my first clinical, I was like a deer in the headlights.
Yeah.
I had no idea what was going on.
Right. You see so many new things that are like, this is...
Like you were bombarded in school with these textbook patients, and then you get in the clinic and you say number 2 is finding ways to learn more. How do you find other ways, and with spare time you have in clinicals, to do that?
Also a great question. So there are the concrete things, like there are many blogs and podcasts and continuing education opportunities, conferences like the one we're at.
Absolutely.
But it's really also important to consider the relationship with your clinical instructor. And to really find ways to interact with your clinical instructor, because this is someone who watches you every day and therefore is able to identify parts of your practice that really could use more developing. So it has to do with really what can you glean from your clinical instructor, or the relationship between you and your clinical instructor that can turn you into a better clinician.
That's great. Yeah, I like that. And that goes right into your third point, which is receiving feedback. I know sometimes it's hard to receive that constructive criticism, but how can you receive that feedback and turn it into something you can put into practice?
Receiving feedback is really hard, and it can be tough, especially if you don't know your CI very well and come out the gates and kind of tell you that those things you did were really not too great, and it can be really hard. I think the first thing to do when you receive any feedback, positive or negative, is to pause. So this is very concrete, to pause for, I would say, at least 5 seconds, to really process what just happened, because an instinct is to get defensive and say, well, I'm trying really hard, and my teachers didn't teach me, and so that's not the way to go. Really, it's pausing and really embracing some gratitude for the opportunity to receive feedback, because really at this point in your internship is where you are to learn more in a concrete way as a therapist. And so the opportunity to have someone point that out for you and say, actually, if you just shape this up this way, then you're going to be much better. That's actually pretty awesome.
Yeah.
So really the chance to have some gratitude with that, and so it can shape the whole conversation with your CI. If you end up pausing, thank you for that. Thank you for that feedback. And so that can really shape that whole conversation, because your CI, and I'm thinking about this as a clinician now who's pretty soon going to start accepting students, that would mean a lot for the student to appreciate the things that I have to say.
Yeah.
And then I think, you know what, this person, they're going to do well, and I want to help them to be a better clinician.
Absolutely. I mean, the whole point of going to clinical is to learn how to actually be a real PT or PTA.
Right, exactly.
Now that you are a real PT,
Yes,
how
real
do you
PT.
use those things that you learned in your clinicals in your practice?
Right, so there are a lot of ways to use what you've learned. I think the best thing to do as becoming a clinician is to maintain the spirit of reflection.
Absolutely.
To really maintain the thought that you have things still more to learn, and you have still more ways to be better. And so on rotations, and I can't speak to everyone's, but for mine, we would have weekly feedback. So we write down what went well, what did not go well. And so actually maintaining that, and I've tried to do it. It's hard, busy, clinic hours are busy, long hours, I understand. But to actually carve out time and say what went well this week and what did not go well this week, as if you're still on rotation, that makes a big difference, because it's easy to sort of like, oh, that was kind of rough. I kind of want to forget about that.
Yeah.
But we shouldn't. And so maintaining the reflection is really essential to becoming better. So.
Well, thank you for those clinical pearls, Zach.
Yeah.
And we're going to conclude this one, and we'll see you guys in a few minutes.
Thank you. Appreciate it.